Hi, I'm Dr. Beresin. I'm a child psychiatrist and consultant with the New York State Project TEACH program. I wanted to take a minute to talk with you about some of the changes you may want to look out for when it comes to your child's mental health. As a parent, you know your child best, and you want him or her to be the healthiest they can be. When you take your child to the pediatrician, you may be primarily thinking about this nagging cough they've been battling or about the broken arm they got on the playground. But your pediatrician is not just a person to take care of the physical or medical problems that your child may face. It's their first stop in all aspects of your child's wellness and development, emotional as well as physical. It's important that your doctor know about any changes that you may notice taking place, especially when it comes to behaviors. Before your child's next scheduled visit, take a minute to stop and think about what may have changed since the last time you stopped in for a visit. For example, how's your child been eating and sleeping? Are there any behavior changes that you've noticed? Changes in mood, changes in anxiety, irritability, relationships with friends? How's their behavior at home? How's their behavior with their siblings? Have there been any changes in academic performance? Is there any obvious change in personality, such as them acting more withdrawn or isolated or crabby? You may want to look at how things have changed in terms of their interests or their activities. So sometimes they're just not doing the things that they used to do. These things can all help your pediatrician determine whether or not your child may be developing behavioral health concerns that should be addressed right away. Knowing about these changes sooner rather than later can help you confront problem behaviors before they escalate or they persist. Many of the behavioral health concerns that we see in New York State begin in childhood, and oftentimes they're first noticed at home, at school, or within recreational activities. So these areas are important places to look for the behavioral changes. And who's better than you to notice them, because you're the first line of defense, and the second line of defense is your pediatrician. Let's work together to ensure that your child is happy and healthy as possible.